The James Lind Alliance works in partnership with patients and clinicians in order to identify priorities that you consider to be of high importance to research. The Non-Alcohol Related Liver and Gallbladder Disorders Primary Setting Partnership will seek the views of people affected by these disorders, including patients, carers and healthcare workers. Your views will be used to collectively agree priorities that are important to you and make them available to bodies like the National Institute for Health Research, which commissions and funds NHS, social care and public health research. We are interested in your views on researching the prevention, treatment and diagnosis of your condition, as well as your views on how research can find ways to improve the support and care needed for your condition. Our survey asks you to tell us these views in 3 parts. First, we want to know what you would like to see researched or investigated. This might include things like testing breathing exercises, looking at the effects of gargling aspirin, or the effects of nurse-led care. Second, we want to know about the group of patients you are thinking about. Non-alcohol related liver and gallbladder disorders covers many different conditions, and you should identify the condition or group of patients you mean. For example, you might mean patients with primary sclerosing cholangitis, or patients who have had a transplant, or maybe patients who might develop a particular condition, or even patients with a particular symptom. So we need to know what you think should be investigated or researched and on whom. But what would be a good outcome or measure of a successful investigation if your research idea was carried out? Perhaps it would be a patient living longer or an improved quality of life. Maybe a decrease in a symptom like pain or itch, or an increase in something like the ability to eat well. Telling us these outcomes informs us what the test or investigation you propose is aiming to achieve. It might be that you think there is more than one important measure of success. For example, you might want to see blood tests researched to diagnose a particular condition, and a good measure of success might be an accurate diagnosis, a reduction in the time taken to reach diagnosis, and a reduction in the time spent in hospital to be diagnosed. Please list your outcomes or measures of success in order of importance, with the most important one first. In summary, we are interested in your ideas and views on the direction research should take. We will ask you to tell us in 3 parts. What should be researched or investigated, on whom, and what you consider to be good outcomes or measures of success for your idea. After you've given us your idea, you will be asked to tell us another idea, or given the option to continue on to the final section of the survey.